Hi, Mary. I'm Dr. Buffalo. Nice to meet you.
Thank you.
Thank you very much for coming in today. So today, we're going to talk about a lot of information. We're going to go over some things that are probably a little difficult to talk about. I want you to try to be as honest with me as possible. That's going to give me the best chance to help you with everything, okay?
Okay.
So, let me start by asking you about your drug use. Can you just tell me about how things got started and how that's been going for you?
Right. I guess I haven't thought about it in a while. I think me and my friends just started using pills when I was in high school, like kind of for fun. And it seems like it's just gotten out of control since then. And now I feel like I have to have it. It's just running my life.
Yeah. How old were you when you started using pills?
I think I was 17.
Okay. So it sounds like at first that was just using that for fun, using that with your friends. When do you feel like that began to change?
It seemed like at some point I wasn't just doing it with my friends, I was seeking it on my own. I guess I was probably maybe 19 when I started going out looking for it on my own.
Okay. Can you give me an idea of how much you've been using?
Lately, I would use like 40 to 80 of oxys a day, depending on what I can get.
Okay, what were the dose on those oxys?
Like 40 milligrams. Like sometimes I can get 10
Okay.
milligrams, and sometimes I can get 20 milligrams. But when you add it up, it's like 40 to 80
Okay.
milligrams a day.
Okay. When you take that oxycodone, are you just swallowing the pills? Are you crushing the pills up, using it intranasally?
I've been crushing them and snorting them usually.
Okay.
Sometimes I inject them.
Okay. When was the last time you injected?
Probably about 3 weeks ago.
Okay. When you've injected, have you shared injecting supplies with other people?
Not for a long time, but I have.
Okay. Can you give me some idea of how this has affected your life?
I haven't been able to do any of the things that I wanted to do. The reason that I'm here today, though, is because my child was taken away from me.
Okay.
And
I'm
I
sorry
feel
about
like if I could get better, maybe I could get them back.
Yeah, absolutely. Are you working or going to school right now?
I'm working a little bit, some part-time work, but nothing regular.
Okay. Do you feel like your drug use gets in the way of working?
I think it does. I think I would accept more hours if I wasn't running around.
Okay. Yeah, for a lot of people who deal with drug addiction, the searching for drugs, looking for drugs, recovering from the drug use, dealing with sickness, it absolutely gets in the way.
Right.
Yeah. What kinds of treatments have you tried for this? Have you tried quitting before?
I have tried quitting before. The longest I was able to go was about 2 weeks.
Okay.
And it seems like I'm doing fine, and then I ran into somebody downtown that I knew.
Yeah.
And it just fell apart for me again.
Okay.
I've never had insurance before, so I've never tried any drug treatments before.
Okay, so haven't been through counseling or rehab or anything like that?
No.
Have you ever been to a Narcotics Anonymous meeting?
I've met people who've gone to 12-step meetings, but I've never gone to one.
Okay. What do you know about drug addiction treatment? What do you know about options that are out there?
Well, I bought some Suboxones,
Okay.
and somebody told me that it could help with the like ups and downs, and I tried it, but I think maybe I took it too soon.
Okay. What did you notice after you took it?
That it made me feel worse.
Okay.
Instead of better.
Okay. And yeah, it can definitely do that. But you're right. If you're taking it correctly, it usually makes people feel better. So We'll talk more about
I'm
that.
a little nervous.
Yeah.
Okay.
Yeah. Do you have friends or other contacts who have taken it, who have used it as a treatment before?
Yeah, the person that I bought it from said that they were doing really well.
Okay. Okay. And yeah, that's been my experience. It does work well for a lot of people.
Okay.
Before we get into that, I want to ask you some more questions. Where are you living right now?
I'm living at my mom's house.
Okay. Okay. Your mom, how aware is she of what's going on?
She is really sick of me right now, but
Okay.
she's still letting me stay in the house.
Okay.
She knows.
Okay.
She figured it out a long time ago.
All right. All right.
She's still giving me a chance. So.
Good. Well, I'm glad to hear that. Do you have any other support in your life right now? Other friends or family in the area?
Yeah, I have a couple of friends who've gotten out. I don't see them very often, but I feel like if I could do better, maybe I could hang out with them again.
Okay. Yeah. Where is your daughter now?
She's in a foster care
Okay.
place. You know, they let me see her once in a while, but she's staying with foster family.
Okay. Okay. As you've been dealing with drug use, have you had any legal problems related to that? Arrest, jail time, parole, probation?
No, I don't know how, but I haven't had any legal problems.
Okay, good, good. Do you have problems with any other drugs?
I've used some other things, but I wouldn't consider it a problem.
Okay, what else have you used?
I've tried meth before,
Okay,
but once I started getting hooked on oxys, I didn't really want anything else.
okay, okay. When was the last time you used meth?
It's probably been 5 years.
Okay, okay. Do you smoke?
Yes,
Okay, how much do you smoke?
I smoke about a half a pack a day. I'm trying to cut down.
Okay, okay, great. Well, we can work on that too. And do you drink any alcohol?
No,
All right.
no, it's the same thing ever since I got hooked on oxys. I don't really drink anymore either.
All right, all right. What other health problems do you have, or do you have any other health problems?
I don't think I have any health problems.
Okay, are there any medicines that you take on a regular basis?
Sometimes I take allergy pills.
Okay.
Yeah.
Okay. Any allergies? Are you allergic to any medications?
I've been told I'm allergic to penicillin.
Okay, all right. Have you had any surgeries?
No.
Okay. Any family history, medical problems, your mom, dad, siblings?
My parents both have high blood pressure.
Okay.
And my brother also has like some emotional problem.
Okay.
I don't know what it is, but he has something.
Okay. Have you had problems like that? Problems with depression or anxiety?
I think so. It's hard to know. I've never been diagnosed with anything.
Okay. Okay. Does anyone else in your family deal with addiction?
No, nobody that I'm related to directly. I'm the only one right now.
Okay. So let's talk a little bit more about treatment.
Mhm.
So Suboxone or buprenorphine can be a really effective treatment for many people who have opioid addiction. And I would say, based on your experiences with opioids, that you would benefit from it. Suboxone works in a couple of ways. One thing that it does is it keeps you from going into withdrawal. So when you do stop using, you don't feel the sickness, the symptoms that go along with those opioids getting out of your system. And that makes it a lot easier for people to stop using. Another thing that it does is it really cuts down on cravings for opioids. So you're not going to feel like you really want to use or need to use. And what a lot of my patients tell me is that they feel like this treatment helps them feel like they felt before they started using opioids.
Like
They feel
normal.
Yeah, exactly. And so that's my goal for you. For some people, this is a treatment that they can take for a short period of time, and they can gradually wean off of it and get to a point where they don't need it anymore. But for other people, this is a lifelong treatment. And that's okay. There's no fixed endpoint here. And I usually tell my patients that for the first 6 months that you're taking this medicine, I want to find the dose that works for you, and I want you to keep taking that dose. And we're not even going to think about tapering it. Because you've got a lot of work to do over those 6 months. You've got a life to rebuild, you've got a kid to get back, and I want to make sure that you can do all of those things, and this medicine will help you with that.
Good.
Do you have any questions about that?
So I need to stay on the medication for at least 6 months.
Mm-hmm. And then we'll just see how things are going. Yeah. When was the last time you used OxyContin?
This morning.
Okay. So one thing that's really important with this medicine is that you don't want to take it while you still have OxyContin in your system. You need to wait until you feel like it's getting out of your system. So with OxyContin, that means it needs to be at least 12 hours after the last time you took it. And it may be up to 24 hours. And what you're going to need to do is pay attention to how you're feeling. And you kind of have some idea of what withdrawal feels like.
Yeah, definitely.
So when you start to feel like that, then it's safe to start taking this medicine.
Okay.
But you don't want to take it until you start to feel those symptoms coming on.
How sick do I have to get?
That's a good question. So for most people, the earliest symptoms that they notice is they start thinking about drug use and they start having some craving. You might start to feel a little anxious, but I want you to go a little past that. I want you to go until you're feeling maybe a little shaky, maybe nauseated, maybe a little cramping, maybe sweating a little bit. Those would be symptoms that say it's time for you to start this medicine.
Like a bad cold.
Yeah, that's a good way to think about
Okay.
it. Now, one thing you can do if you're not sure about being able to monitor for those symptoms, the safest thing to do is just wait 24 hours. So wait until tomorrow morning to start the medicine.
Okay.
And that's okay to do it that way too. But if you wait long enough, then this medicine will make you feel better instead of feeling worse.
Right, that's what I heard.
Yeah. So since you don't have insurance, what I'm going to do is prescribe you the least expensive form of this medicine because it can be pretty expensive depending on what form you're buying. What I'm going to prescribe you is a generic buprenorphine tablet. Sometimes it goes by the name Subutex. And so this is a pill. And you've taken this before, so you know you put it under your tongue and you let it dissolve. And you want to let it dissolve completely. Really try not to swallow it because anything you swallow is not going to be effective. Okay? So you want to let it completely dissolve and then it all gets absorbed through your cheeks. When you start this medicine, I want you to split the pill in half the first time you take it. And I want you to just take half a pill. So just take half a pill, give it about an hour and see how you feel. And what I'm hoping is you'll notice that you don't feel sick anymore. You notice that your cravings are going away. If after an hour you still feel kind of sick and you still feel some cravings, go ahead and take the other half of that pill. But I don't want you to take more than one pill the first time you take it. And then if you do end up needing to take both halves of the pill, then the next day you can just go ahead and take a whole pill at the beginning of the day. And I'm going to prescribe you enough medicine that you can take one pill a day until I see you again. That might not be the right dose for you. We may have to go up, but it's a good starting point. And then the next time I see you, we'll keep working on that dose. Okay?
Yes.
So I want to make sure that you understand the instructions that I gave you. So can you kind of tell me what I said about when to start it
Right.
and how to take the medicine?
Right, so I have to wait until I start getting anxious and feeling nauseated and like achy, and maybe like I get chills sometimes.
Mm-hmm.
And that would be around 8 hours for me, I think. And then I would take half a pill and put it under my tongue and let it dissolve completely, and then see how I feel.
Mm-hmm.
And then take the other half if I need it.
Mm-hmm. Good, good. So when I see you again in clinic, we'll talk about how that's working, and then we'll make more adjustments. Do you have a pharmacy that you want to use for this?
Yeah, I'll use the one here.
Okay, so I'll go ahead and send that to the pharmacy today, and you can pick that up before you leave.
Mm-hmm.
A couple of things that I want you to know about our visits here. So one thing, this is information that I give to all of my patients. This covers kind of the general things that I expect of my patients. You can take this with you and read it over. It's all pretty basic stuff. It's about taking the medicine the way it's prescribed, not giving it or selling it to other people, and making sure that you keep it in a safe place so that other people don't take it from you.
Right.
So I'll let you take this with you and read it over. This is also the clinic appointment and refill policy. So with this medicine, I'll only be refilling it at your appointment. So I really try not to call in prescriptions or fax in prescriptions. I want to see you to see how you're doing.
But if I run out before our next appointment,
then you can contact me, and yeah, I can always send in a few extra pills to last until I see you again. But we'll try to get your appointment set up so that you see me again before you run out of medication.
okay.
So we'll be seeing a lot of each other. So I'm going to see you back again in 2 days.
Okay.
And I'm going to prescribe you enough that you can take a pill every day until I see you back again. If things are going okay, our next visit after that will probably be a week later, and I might see you every 1 to 2 weeks for the next month, just until we get things figured out.
Okay.
Okay. After that, we'll be able to space out those visits a little bit.
Okay.
One thing you need to know about my visits here is that every time you come in to see me, I'm going to have you give a urine sample for a drug screen. So my nurse will hand you the cup when you come in. And it's important to know that is not about catching you or busting you. That's so that I know what's going on. And I want you to be honest about your drug use. If you use OxyContin, I want you to tell me about it. Because that's how I'm going to take good care of you. I've never fired a patient because they used. That's not how it works.
Okay.
It just means that we need to figure out what's going on and how else I can help you. At future visits, we'll talk about things like Narcotics Anonymous meetings or counseling resources so that you can access those things if you think they're going to be helpful.
Yeah.
Okay? Another thing that we'll talk about next time is going to be some lab testing. It's important for anyone who's ever injected drugs to be screened for things like hepatitis C and HIV. So we'll look into that later.
Okay. My mom's paying for my medicine and my visits right now, so I'll ask her about that.
Okay. And that can be something that we can put off for a little while. Certainly, I think the biggest priority right now is getting you doing well. Okay. So any questions about that?
No, I'm feeling excited.
Good. I am too. So I will go ahead and send your prescription to the pharmacy. You can go ahead and head to the front desk and just tell them that you need to make another appointment with Dr. Buffalo for 2 days from now.
Okay.
And I'll see you back then.
Great.
Okay.
Thanks.
Yeah, very nice meeting with you.
You too.